Florida Surgeon General isn't shy when it comes to his feelings about fluoride in drinking water. He's strongly opposed to it.
Dr. Joseph Ladapo says it isn't an issue of the mineral's dental health benefits, but he's not buying the argument from dentists about a lack of access to fluoride. Wait News anchor Claire Galt has more.
Florida Surgeon General Dr. Joseph Ladapo has made stops around the state. His mission to talk to local leaders about what he calls the danger of fluoride in drinking water.
Who suffers the most? Well, so far it's children and pregnant women.
In Lee County, it worked. Commissioners voted to remove fluoride earlier this month. In the city of Fort Myers, council members said, not so fast.
I wasn't there at Fort Myers, but I certainly support commissioners acting in the best interests of their communities.
Because Ladapo told me he knows firsthand it can take time.
When did you start to think that fluoride in water is unnecessary?
There was a federal ruling really that required the EPA to perform its regulatory duties around fluoride. So I was shocked that even as a physician and someone who, I have a doctoral degree in health policy, done many years of research, this was something that I wasn't even aware of.
That ruling came in September of last year. By November, Ladapo had released this guidance to communities across the state, citing studies he says showed
a very clear association between fluoride exposure and health outcomes, adverse health outcomes, specifically neurotoxicity, specifically neuropsychiatric effects, and even effects in other organ systems, such as in the thyroid.
But many dentists, like Dr. David Martinez with First Street Family Dentistry in Fort Myers, fear there's not enough research.
What we don't want is to rip it out cold out of our water and not have those benefits that have been protecting our, especially lower income populations.
The main argument we hear from critics is that underserved communities don't have enough access to fluoride. What do you tell those people?
I would say two things. I'd say first, it's just not supported by data. But secondly, I think that it's too myopic in its focus on fluoride. So dental health goes way beyond water fluoridation. There's access to toothpaste. There's access to just good education about good dental practices.
Ladapo told me it's not a debate over whether fluoride is good for dental health. That's a fact. He believes it's about whether it should be in our water. Claire Galt, Wink News.
A large majority of the Florida communities that have removed fluoride are conservative areas politically, like Collier and Lee counties in the city of Naples. Claire asked Dr. Ladapo if this is a political issue. He told her it shouldn't be.